Go right there.
Every time
Right there. One of the greatest pros right here that I've known since she was an amateur.
Yeah.
Oh,
Big
man.
time amateur.
Yeah. So give me a rundown. It's been a while since I worked with you. What are we going to do?
Since I've been battling a shoulder injury on my left side, I was hoping we could work on that in my back.
What kind of shoulder injury?
Well, I've got some tears
Oh, boy.
around the whole thing, around my whole, by my rotator cuff, all up through the back. I have some minor tears. I'm pretty sure they want me to see a orthopedic after I'm done this year.
Are you going to need surgery, or is it just something you can just take care of with rehab?
Well,
Maybe.
I think I could probably rehab it, but
Yeah.
I think they're possibly wanting to do like orthoscopic. We'll see. I'm not gonna worry
Okay.
about it until
You can still train. You can still do all that.
I work around certain things.
Okay.
There's certain things I definitely have to
How's the range of motion? Oh boy, that's not good. The other arm is good though. You can move it.
Yeah.
So,
So
all right,
it's a
that
little
internal
sore.
internal rotation is good, but going back out, external rotation, that shoulder blade's not moving well either. I can already tell.
No. So and you can see when I stand, it's like I'm like this.
Yeah.
Stand like
Can we see? Can you take the?
Yeah. So you can tell when I stand.
Oh yeah, yeah. See, move the arms just straight up. Yeah, that's not good movement there.
No.
Oh man, let's see what it looks like the shoulder blades. Turn around. Yeah, and then just move the arms up and try to do that external rotation as well. See what that. Yeah, see, everything's just locked up. Oh
Yeah.
man. All right.
Yeah, it hurts, and it hurts up into my neck. So I found out too. I've got what was it in my C3? It was 4 and 5 or.
Really.
Yeah.
Oh boy, that's
So I've got
not
some
good.
I've got some things
I
going
mean,
on.
you can
but
still work through
I'm
it, but
totally fine.
you
I'm
tell-
okay.
That's what every bodybuilder says. I'm okay. I'm good. I'm good.
Okay. Yeah. Yeah.
What's going on, everybody? Welcome back to another breakdown of the torch room theory. And here I have a client, as you saw from the intro, has very hard time with mobility in the shoulder. And we know it's that external rotation. There's some extension she's having trouble with. And as she said, there was some drama going on in the neck, C3, C4, C5. So how did we start this? And I'm going to show you how I broke this down and what's going on in my mind as I'm working on this tissue. So I started on the upper fibers of the pec, and I'm doing some cross fiber friction there. And why I wanted to start here is because I wanted to get that abduction of that arm to get a little bit more smooth. We don't want to go right into that external rotation. So even though we know that with the external rotation, the active muscle groups are the rotator cuff muscles, the infraspinatus and that teres minor, but we don't want to get to those yet. I want to start on the anterior chain first and just relax the upper fibers of the pec. Plus, it's also going to relax and open up those fibers to let the nervous system that comes out of that C3, C4, C5 and just have room to move. And for all the LMTs out there, we all know that's where the brachial plexus nervous system goes through and those scalene muscles. So I even decided to get real close to that, to the clavicle, right underneath the clavicle. It's good. You kind of see like rib 2, you kind of feel it, and that's where some of the scalene muscles from the neck attach to. So, but as we get this muscle relaxed, and it's the upper fibers of the pec major, we start to bring, after abduction, we start to bring a little bit of rotation, and you can see right here it's getting stuck. Right there, it was not working too well. So guess what? Now we're going to move along to the shoulder. Now that we dedicated some time to the pec, let's get to that anterior delt. And we just want to soften this up. Again, I am looking at manipulating the stress level of the tissue. I'm not even thinking about what's really going on with the acute issue, which is I can't do external rotation. I'm actually palpating of the muscle tissue that helps assist with that movement. So after relaxing that anterior delt, I go straight to the subscap. This is a painful area, but I'm just doing a pin and stretch here. Not really doing any manual therapy, no cross fiber friction. I'm just pinning it down to see if I can get rotation in that shoulder socket. And as you can see, it's able to move. So this lets me know right away that there's hope. There is hope for this person. And I don't think that it's as severe as she came in to think about, and she's already talking about, I think I might need surgery. Again, if we can relax assisted muscle groups and synergistic muscle groups, we can get movement right back. And knowing that she is an athlete, she should know how to rehab this pretty well. But the first thing, at least in my mind, is can we open up the muscle tissue? Can we get it to relax? Can I manipulate all that stress that's bringing it into that shoulder socket? Next, I decide to move into the bicep. And here I just want to get straight from the elbow attachment point, and we're just going right up into that coracoid brachialis. That's where I'm getting into. I'm going from that inner bicep head to that coracoid brachialis muscle, and you can barely see it, but I am turning the wrist. Now, the coracoid brachialis muscle, that is a very unique long bicep muscle that primarily gets activated with wrist rotation. So if you can see, I'm kind of turning that wrist, just trying to see if I can manipulate that and see if I can release the tension off that shoulder blade, because it attaches to a place called the coracoid process. I know all these words kind of sound a little weird. I get it. It was even hard for me to learn. But once I got things to relax just enough, guess what? Rotation is actually opening up more and more, and she's actually not going through so much pain. So it's like there is a lot of hope here just by manipulating the stress level of assisted muscle groups. And this is before we even get into that infra and the teres that actually help assist with, they're the main active muscle groups for that external rotation. There I decided to do some muscle scraping on the attachment point of the common flexor tendon, since that's where that coracoid brachialis attaches to. And again, I'm really dedicating some time to this. This is a breakdown of a full 1 hour session broken down into 12-minute sessions. So we dedicated a lot of time. So how the muscle tissue felt at the beginning, it must be completely different at the end. And as you can see, the client can actually handle most of this work now. At first, everything was really stuck and rigid. And, we just want to get things to open up and see if we can just get this muscle tissue to relax just enough so it doesn't put that pressure on that shoulder joint. I even decided to get on the pronator muscle here in the forearm. I'm going from the elbow to the wrist, even though it's, opened up like this. I think it's very easy to work with, just like this. And again, actually working it just like this gets that arm to drop down even more. And when that arm drops down even more, it actually depresses that shoulder blade even by the smallest amount. And that's going to allow for better movement and just tension off not only the glenohumeral joint, but the AC joint. Now here I wanted to attack just the teres minor just a little bit. Now moving into the teres minor, I decided to start off with some scraping, and I'm using bone here. And I like to use bone when it gets really close to joints. And this is a very small muscle and it's very superficial work. So we're mostly targeting the fascia when I do the scraping. A lot of people experience some burning, maybe some pinching, just because that fascia is that high sensory organ. But it's nothing to aggravate that muscle tissue in any way. It's just to soften up that fascia to get movement in there. And here I'm starting with some trigger point work, and I'm right on that teres minor infra, kind of in that realm right there. And I'm just trying to bring some movement into that shoulder joint, and it was starting to move really, really good. Again, when fascia gets really tight and it starts to adhere to the muscle tissue too much, it's going to limit the movement and pliability of the muscle tissue. So I did do a little bit of work on that anterior serratus muscle just to bring better movement into the glide of the shoulder blade, and then work one right back into that subscap. And as you can see from earlier in the video, so I don't know if you stayed along this far, I hope you have, but from working at the subscap in the beginning of the video to now, that arm is moving a whole lot better. We're bringing in so much range of motion. We're moving that arm in and out, we're lifting it up, and all while I'm pinning down that subscap. And even with some good arm flexion forward and extending that arm all the way up, that arm is starting to move really, really good. So it's bringing the pressure off the joint. So, and I try to tell people so many times, massage therapy has so many benefits, endless benefits, if you can just learn how to manipulate the stress level of muscle tissue or fascial tissue that's causing limitations with your mobility. So, and now here I'm just going to end it on this side, on the anterior side, just with a little bit of gliding on that radial brachialis muscle. I like to hit this a lot when there are shoulder issues, any kind of shoulder issues. I like to hit this area. It really does play a role with the rotator cuff muscles. So, you know, and here we moving on to step 2. I'm attacking straight the rotator cuff muscles, mainly that infraspinatus and that teres. So we're doing some trigger point work on that infra. And if anybody has ever had trigger point work done on the infraspinatus, that thing is painful. It is very sharp, and you feel it on the anterior side of the delt just because that's where it's closely attached to. So, and then we're moving into that teres minor. These two, I like to go back and forth on them just to get that muscle tissue to relax and bring as much pliability as I possibly can, because even though we can get this arm to move a little bit more and relax muscle tissue, we want her to be able to move while she's standing up, and that's totally different dynamics. So I even decided to hit the medial head of the tricep just because it runs right through the infra and the teres minor. It runs right, and it attaches to that lateral border of the shoulder blade. So I do hit up that tricep in a rotation of the infraspinatus, the teres minor, and then the tricep, all going one after another, kind of like circuit training. We just hit one to the next to the next. We did about 3 rounds of this. Again, this is a 1-hour session that got broken down to about 12 minutes. So I'm just explaining how I broke it down and what I'm looking for and what muscles I attacked and at what category I decided to go to. And if you notice, this was an external rotation issue with a neck issue. So even though, you know, with that external rotation of the arm, you know, that infra and the teres minor are the main active muscles that help with that movement, I decided to go opposite of that and work towards the acute injury or adhesions or whatever is stuck. So, but we did relax the trap and that supraspinatus just a little bit. And then here I'm working on that posterior serratus muscle. So again, the anterior serratus and that posterior serratus just help a lot with that scapular delivery and get that shoulder blade to really move in all its planes. And that's really all I want. Even though the main focus was to bring external rotation, I really like to look at all muscle groups, active muscle groups, assisted muscle groups, synergistic muscle groups. And here we're just ending it up with some cross fiber friction on the trapezius. That's a big, thick muscle, and relaxing that rhomboid. And I think this will really help this person just get more mobility. As you've already seen, that shoulder blade is already moving so much better. And now it's up to them to keep rehabbing it. And they should be able to perform just even better out on the gym floor. And just to be nice, I decided to relax the neck up, and this client really liked that portion of it. It was only like the last 5 minutes, so hope you enjoyed this one, people.
Yeah, it's.
We just want to bring some mobility to the shoulder.
Oh, yeah, I can finally
just
move it.
Try to move it a little bit. Oh, look at that.
Yeah, it's a lot better.
Good swing back.
Oh yeah.
Move it straight up. Oh yeah, look at how
Yeah.
straight that arm goes back up.
Yeah. It's not as out here.
Oh man, another survivor.
Another survivor. But it's always so worth it.